has killed more than 170 people in China is spreading to other countries, alarming health experts. There is a new coronavirus, with the majority of cases affecting people in mainland China who have recently been in the city of Wuhan, China. There is much more to learn about how it is spread, its severity, and other features associated with 2019 nCoV, and investigations are ongoing. At the moment, this coronavirus is called 2019 novel coronavirus or 2019 nCoV. What is a coronavirus? According to the World Health Organization, WHO, coronaviruses are a family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. These viruses were originally transmitted between animals and people. What are the symptoms? Most case patients have had fever, cough, and shortness of breath, with further evidence of pneumonia, chest infection. The incubation period, time between exposure and onset of symptoms, likely ranges between 2 and 14 days. How is it spread? Most of the early reported cases had contact with seafood and live animal market, suggesting an animal source of the outbreak. However, most cases are now likely to be spread from person to person by droplets when coughing. Who is at risk? People who are living or traveling to affected areas or who have had contact with other cases may be at risk of catching the disease. People with underlying illnesses that make them more vulnerable to respiratory disease, including those with diabetes, chronic lung disease, pre-existing kidney failure, people with suppressed immune systems and the elderly may be at a higher risk. How is it prevented? It's likely that general prevention measures used for other coronavirus infections will also prevent infection with 2019 nCoV. The World Health Organization, WHO, recommends measures to reduce the general risk of acute respiratory infections while traveling in or from affected areas by avoiding close contact with people suffering from acute respiratory infections, frequent hand washing, especially after direct contact with ill people or their environment, avoiding close contact with live or dead farm or wild animals. People with symptoms of acute respiratory infection should practice cough etiquette, keep away from other people, cover coughs and sneezes with disposable tissues or clothing, and wash hands with soap and running water for at least 20 seconds. Travelers to China should not visit live bird and animal markets, including wet markets. There is currently no vaccine to prevent 2019 nCoV infections. How is it diagnosed? Infection with 2019 nCoV is diagnosed by finding evidence of the virus in respiratory samples such as swabs from the throat or fluid from the lungs. Testing for 2019 nCoV is done in public health laboratories. How is it treated? There is currently no specific treatment for people who are sick with 2019 nCoV, but early diagnosis and general supportive medical care in hospital can be life-saving.